Services and the Child Care Policy Bureau. So, and glad you could take this evening to join us. I'm excited. This is about the third or fourth year we've had Jeremy from Iowa Navigator come and present information about the health insurance marketplace. And it's a great opportunity to get that health insurance coverage.
Yeah. Thanks, Tammy. So yeah, my name's Jeremy Smith. I'm the program director for the Iowa Navigator program, and like Tammy said, I've come on this time of year about 3 or 4 of the past years, and it's always been a really good audience for me to talk to, and we've been able to help a lot of people through this. So a lot of really good information that we hope you'll take away from this. So I'll have our contact information throughout, but our phone numbers here, our website, acanavigator.com. Please follow us. We've got social media. We're always looking for some help getting the word out about this free program. So check us out on the website. Um, the point of tonight is to explain a little bit more about what the Iowa Navigator program is and how it can help people. And then also to talk a little bit more about health insurance programs that not everybody may be as familiar about. There's a lot of options that people tend not to really learn about until they need it. So we want to talk a little bit more about those options. And so a little bit more background about my organization. I work with a nonprofit organization called First Choice Services, and we're headquartered in West Virginia, and we specialize in social service and behavioral health helplines. And so a lot of the 800 numbers that you see on billboards, maybe that you call for help, we do a lot of those type programs, and we've really expanded into this space, and we've continued to add programs that help people, and we continue to build up our staffing. And so a lot of really cool programs that we offer. So for example, we answer the 988 suicide prevention lifeline in West Virginia. And then we also have a national contract to do 988 work for chats and text for the whole country. So a lot of really good work being done there. We also do the 1-800 Gambler program for folks dealing with a gambling addiction in West Virginia. We do the Children's Crisis Line in West Virginia. We do the Addiction and Mental Health Helpline in West Virginia and Pennsylvania. We help answer 211 calls in partnership with United Way here. And then we do these navigator programs that help people find and sign up for health coverage. And we've been doing this in West Virginia since 2015. And then in 2019, we started doing it for Iowa, Montana, and New Hampshire as well. So that's kind of my specialty, is operating those navigator programs and making sure that we can get that free assistance out to the public to help sign up for health coverage. And so just a little bit more about what a navigator is. The Navigator program was created under the Affordable Care Act when it was passed in 2013. And so what it is it's just a free, federally grant-funded program from the Centers for Medicare and Medicaid Services, from CMS, just to provide free assistance to people that need help finding and signing up for health coverage. And so what we specialize in is the plans on the health insurance marketplace, Medicaid, and then the CHIP program for kids, also known as Hawkeye. So these are the plans. A lot of people are kind of familiar with Medicaid and CHIP, but maybe not as familiar about the marketplace plans. And so this time of year, it's really important because open enrollment is getting ready to start on November 1st. And so for folks that don't have health insurance, this is the time of year to pay attention so that you can get signed up. So like I mentioned, we started doing the Navigator work in Iowa in 2018, and we remain the only Navigator grantee for the state. We're statewide. We help people all over. We've helped at this point hundreds of folks enroll. And this group that I'm talking to tonight, we found a few years ago that people that work in early childhood education tend to not have health insurance. And also, you're often interacting with families that may not have health insurance. So we got this idea to start doing this webinar and get the word out because it tends to be really helpful for this group to be able to get health coverage for yourselves, your employees, your friends, and then also the families you work. And so we've got, pretty good news about our program too. For the past 5 years, we've always only operated the program over the phone. We've always just been headquartered and based out of West Virginia. You could call and we could help people sign up over the phone. But in August, just a couple months ago, we was extended for another 5 years on the program, and the funding significantly increased. Back a few years ago in 2018, our operating budget was like $100,000 a year. So it wasn't very much, enough for just a couple staff. But we just found out a couple months ago that we was able to get $1.25 million a year. And what we're going to do with that is we've been able to hire additional staff, including bilingual navigators. But the really exciting part is that we've been able to we'll be able to offer in-person assistance now. And so we was able to go in and hire 8 people that's on the ground throughout Iowa to be able to offer in-person enrollment assistance. And they'll be able to travel, do community outreach, give presentations, hand out literature at information booths, and then even travel to maybe your centers. They can go into small businesses and meet with employees and help them get signed up that way. So we're really excited that we're going to be able to offer this. We've got people hired and trained up already. And so our offices will be based in Cedar Rapids, Des Moines, and Sioux City. And then we'll, of course, be traveling around the state as well. So I did the webinar earlier today to the afternoon group, and we've already had some centers reach out to us so that we can come in and help their staff. So we're really excited that we're going to be able to offer that this year. And so just a little bit more about the health insurance marketplace. The marketplace is the plans on what is healthcare.gov. And the marketplace is designed for people that usually can't get insurance somewhere else. If you can't get insurance through, Medicare, Medicaid, an employer, the marketplace plans, these are private insurance companies that offer plans. And then usually for almost everybody, you can qualify for a monthly subsidy, and that's called the advanced premium tax credit. And that helps you pay for the plan you picked out. And depending on your income, it could pay for all of your plan or some of your plan. So it's a little bit different for everybody. There's a variety of plans to pick from on the marketplace. That each carrier will generally offer bronze plans, silver plans, and gold plans. And so a lot of people, you're familiar with like an 80-20 plan, maybe if you've ever had insurance through a job. That's generally a gold plan in a lot of cases. So it's important to look at what all's offered. The bronze plans may not cost very much or anything per month, but they may have higher deductibles and copays. Silver plans are kind of in between, and then those gold plans, they're going to be a little bit more expensive per month, but your deductibles might be lower. And so if you offer insurance on the marketplace, these companies that offer plans, they have to be in good standing with the state. They all have to cover what we call essential health benefits. So all the plans have to cover at least the same 10 things. They have to offer at least one silver and one gold plan. And then they have the price that they charge on the marketplace, it has to at least be the same price that they would offer if you bought it directly through their company. So there can't be that price discrepancy. And so a little bit more about the essential health benefits. These are the 10 things, the 10 health benefits that every plan on the marketplace has to cover. And so that way there's no surprises for you. It used to be years and years ago, if you got insurance, in the fine print of the contract, there could be a lot of exclusions and you wasn't sure exactly what you were getting. That's not the case nowadays. With these essential health benefits, if you pick your plan on the marketplace, you know that it has to cover hospitalizations or outpatient care or emergency rooms or prescriptions. So a lot of different things that it has to cover as long as you get that marketplace plan. The other good thing about all the marketplace plans is all of them have what we call preventative care that comes along with the plan. So no matter which plan you pick out on the marketplace, all of them offer the free preventative care benefits that come along with the plan. And so as long as your provider bills it as preventative, it's going to be a free benefit along with having that plan. And there's a whole list of different things that these preventative benefits can cover. And so we can help you go through that list and make sure you understand what all's on that list and you can use for free. So, in order to be eligible for a marketplace plan, you do have to live in the United States and live in a state that is served by the marketplace, which Iowa is. You have to be a U.S. citizen or lawfully present. So even if you're not a citizen, but you are here, have legal status, then you can look at a marketplace plan. And then you can't be incarcerated. And so this is probably the most important part of the marketplace. And this is what is very hard for a lot of folks to understand. Um, like I mentioned, these are private insurance companies that offer plans, and they're generally designed for people that can't get insurance through your job or Medicare, Medicaid, or the VA. So if you can't get insurance through any of those avenues, you can pick out one of these private insurance plans, and then the government will help you pay for the plan that you picked out. About 90% of everybody in Iowa that gets a plan on the marketplace can qualify for this monthly financial assistance. And so it's called the premium tax credit. And the amount that you can qualify for is based on your projected annual income, your family size, and your age, and then your geographic region of where you live. And so it's different for everybody. I always get asked, well, how much do these plans cost? And that question's too impossible to answer because it really is different for every family. Um, Everything depends on those four factors that I mentioned earlier. So the best advice I can give people is just check into it. Even if you've checked into it maybe 2 or 3 years ago, it's worth checking into it again every year because the plans change, the prices change, and then the amount of premium tax credit you could get also changes. The other thing to really take notice of when you get a marketplace plan is that it is tied to your tax return. So it all depends on what you estimate your income to be when you sign up for this plan. And then when you file your taxes at the end of the year, they compare what you estimated your income to be versus what you actually make. And so, for example, let's say that you estimated your income at $40,000 a year, but then you make more than that. Then you may end up owing some money back to the IRS. But let's say when you file, you made less than your projected income of 40,000, then they may owe you a larger tax refund. So everything kind of washes out each year when you file your taxes. The other part about this program is that you can also qualify for extra help when it comes to your deductibles and copays. So for anybody that's under 250% of the federal poverty level, you may also qualify for what we call the cost sharing reductions that makes your deductibles go down and also your copays. So if you're under that 250%, it's important to look at these plans because it can get really cheap for you. So, like I mentioned earlier, the reason that we're doing this webinar this evening is that open enrollment is getting ready to start. So, open enrollment will kick off on November 1st, and it will go through January 15th. And so, anybody that wants to get a plan starting as quickly as possible, You want to sign up anytime between November 1st and December 15th. And if you do that, your plan will start on January 1st. But if you don't sign up before December 15th, anytime that if you sign up anytime between December 16th through January 15th, then your plan's going to start February 1st. And so open enrollment's really important for a lot of people. This is your one shot a year to sign up. The only exception to that is if you could qualify for a special enrollment period if it's outside of open enrollment. And so for most people, that means if you lose your existing health insurance in the middle of the year, if you lose health insurance, then generally you have 60 days from the time that you've lost coverage to get that special enrollment period and sign up still. And then, of course, there's also some other reasons. Let's say you moved, got married, added a dependent, divorce, those kind of things can also potentially give you a special enrollment period as well. And so this is also a special kind of special enrollment period that we're still going through right now. So I wanted to talk a little bit more about what's been going on with Medicaid for the last few years. And so during the pandemic, a lot of people was laid off from their jobs. They went on unemployment. A lot of people lost their health insurance. And so for all those folks that became eligible for Medicaid over those years, they were really allowed to keep it all during the pandemic. The federal government asked the states to just kind of freeze everybody onto Medicaid. That way they wouldn't lose those benefits in the middle of the pandemic. And so for that 2 to 3 year period, everybody could keep Medicaid and they didn't have to do their yearly reviews with the Medicaid office to see if they still qualified. But over the past year or so, we went through what we called the Medicaid unwinding. And so what the unwinding did is it allowed the Medicaid office to go back and look at everybody's case again to see if you still qualified or not based on your income. And so if you were over income, you may have lost Medicaid over the past several months. And so anybody that has lost Medicaid since the pandemic started, you can take advantage of a special enrollment period right now. And so even if you lost Medicaid even a year ago, if it was through this whole Medicaid unwinding process, you can get a special enrollment period for a marketplace plan if you qualify, and you could get enrolled right now. And so if you called us before the end of October, we could get you signed up for a November 1st start date. If you call us in November, we could get you signed up for a December 1st start date. So it's just something to consider if you have lost Medicaid and you need health insurance. If you're able to sign up for Marketplace and get that special enrollment period, we potentially could get you started right away. The other major change that we've seen with the Affordable Care Act plans over the
I'm gonna
last
hope
year or
Jeremy comes
so.
back on here.
Are you still there? Tammy, can you hear me?
Tammy, are you still there?
Can you all still hear me?
I can.
Okay. Did I lose you at any point?
No.
Okay. Well, I'll get back to it then. Can you all see my screen again?
Yep, but now you have that big, oh, there. The black boxes are kind of gone now.
Okay. Okay. So I wanted to talk a little bit more about what's changed with the marketplace plans over the last year or so. Um, the first major change that happened last year, but it's still relevant even today, is that the marketplace fixed what we have always called the family glitch. And what that means is before they fixed this, if you had an offer of employer coverage from your job or your spouse's job, it didn't really matter what the affordability was. If you had an offer from your spouse's job, it blocked you from being able to get a marketplace plan. And so they've been able to update that and fix it. And there's now an affordability test. So if your spouse's job offers you a plan, but it is considered unaffordable, then you potentially could look at a marketplace plan now. And so that's been huge for a lot of families because oftentimes, if you work somewhere, your employer will offer the employee an affordable plan. But if you want to add your family onto it, it tends to get very expensive. And so now, for the first time, if we find out and we look at it with you and we find out the price is unaffordable, we could look at a marketplace plan for folks. And so we had a lot of people switch this last open enrollment period and take advantage of this. So it is something to consider if that was something that was keeping you from health coverage before. The other thing that happened last year that we've seen has just been a huge factor with all of this is the plans are just flat out more affordable. They're more affordable than we've seen. Nationally, about 4 in 5 people can get a plan for starting at under $10 a month. So it's definitely a benefit to consumers, and people have been able to take advantage of it. There's been a record number of enrollments in marketplace plans since these new affordabilities came in. The other major thing is even higher income earners may now qualify. It used to be that there was kind of a cliff that if you made even $1 over a certain amount, you couldn't get any of the subsidies. But now they've kind of phased that out, and even higher income earners could get subsidies in a lot of cases. So here is the 5 carriers that are offering plans for the health insurance marketplace in Iowa this year. So we've got Ambetter, Medica, Oscar, United Healthcare, and then Wellmark. And so this is an expansion. This is more carriers than we've ever seen on the marketplace, at least since our organization has been working in Iowa. So this is great news. This is a lot of new options for people, depending on where you live and in which county you're in. And so we really want people to take advantage and look at all these new options this year. Like I mentioned, we also do help people with Medicaid and Hawkeye signups. So I wanted to just kind of throw this up here so you could see the income guidelines, especially for Hawkeye. This is huge for kids because a lot of families do fall into the income categories on this and can get coverage for their children through Hawkeye. And then, of course, Medicaid. A lot of people can qualify as well. So it's important to look and see if you can qualify. And the good thing about Medicaid and Hawkeye is there is no open enrollment period. You can sign up any time that you think you're eligible. And if you need some help with that, our folks can always help you through that process. So if anybody's interested in trying to get some help from a navigator, you can call us. And like I mentioned, we can help you over the phone. We can schedule an appointment to call you back and help you over the phone. And then, of course, we also have those new in-person offices around the state as well. And so if you just kind of get a little bit of information together first, mainly just kind of estimating your income for 2025, and that's going to be the gross income, then we can pretty quickly get you some price quotes and help you look at what you may qualify for. And so just to recap, here's some of the more common programs that you can get when you're looking for health insurance. So you can always look at group insurance, whether you work somewhere that offers insurance or you own your own business and maybe you want to go that route. The marketplace insurance is for folks that can't get group insurance, and that's through the plans on the healthcare.gov. And then, of course, there's Medicaid and CHIP. So these are our 4 major categories when it comes to folks that are looking for health insurance right now. If you would like to receive some more information from us, we would love to send you out some flyers, some business cards to hand out to your employees, your coworkers, or your families, or if you're involved in any community groups. We really want to get the word out about this program to the whole community so that we can get just the general uninsured rate down in Iowa and make sure that more people get coverage. So if there's any way that we can send you some information, or if we can come to your site, if it's possible and it's close enough to us, we can even come to you and help your employees get signed up if you're interested. So if you are interested in anything like that, you can reach out to me. It's navigator at firstchoiceservices.org. And then, of course, our website, acanavigator.com. And then we've got our Facebook page and we've got social media, and we're always trying to get more followers to help promote this great program to everybody. So if anybody needs more assistance or they have questions, please let us know, and we're happy to help any way we can. So I'll go ahead and jump off here and take questions if anybody has any.
You can unmute if you have questions.
All right.
Well, thank you, Jeremy. And it's been a great, our having you come and present. Thinking back, it was, 3, 4 years ago
Yeah.
when I saw an article and information, and then actually reached out to Iowa Navigator in the chat, asking to meet with somebody from your organization, which was you, and to
Yep.
really learn and how we could collaborate more to help support childcare businesses, whether you're a home provider, home-based provider, and you're your own business owner, or a center with additional employees, because this really is an avenue to offer and to think of it as a benefit for your
Mhm.
like centers for their employees, and to really promote that as an opportunity to work for you. That way too, you can save money if you wanted to if you were planning to invest in some health insurance, but have better quality policies, and then potentially use that funding for other things, like maybe paying a little bit of a retirement fund, or something like that. So it's a good way to bring in benefits for childcare centers too, for their employees, and fantastic too for home-based programs. All right, thanks everybody for your time this evening.
Thanks, everybody.
Thank you. And then for those of you, if you need, we will be putting a recording of this up on the CCR website. So if you need to review it again before you contact Jeremy or one of his navigators, it will be there for you. All right. Thanks, everyone.